everyone. Today I'm going to go over my psychiatric records from the second hospitalization. I was in the hospital for my schizophrenia. Let's see. It says I was admitted on March 7th, 2012. And it says Brie Martinek is a 22-year-old female who runs a dog grooming business who first came to our attention at the BHI approximately a year and a half ago in November 2012. This was her first admission when she started having psychotic symptoms and was brought into the hospital at that time. She has also had a long history of an eating disorder, both of purging and starving type, and anorexia nervosa as a secondary diagnosis. The patient was admitted during that time, was discharged, and followed up with We Were Human services. Most recently, patient was admitted to Davis Hospital. I was in there 2 months before I went to We Were Human Services just for like a few days or something, and then they brought me back to the McCady Hospital, and this is the record from there. And was discharged less than a week and has been found to continue to be psychotic and refusing all her medications and not eating. This was the time when I wasn't eating. I started not eating for 7 days straight, and just had small bits of Crystal Light. I did have problems throughout my illness of not eating. Like I would think it was like spiritual. For spiritual, like I would just be doing it for fasting, but I would do it way too much. And I did that throughout my schizophrenia. The patient was brought to the emergency department on a white sheet from We Were Human Services, saying that she is spending an inordinate amount of time praying, displays inappropriate laughter and affect, and continues to respond to eternal stimuli. She refuses medication and not following through in the court-ordered treatment recommendations. She said in crisis that this is a big mistake and she does not need meds because she has found Jesus and is cured. She has to be watched closely in the emergency department because she kept wanting to leave, and on the history of present illness when trying to evaluate the patient, same thing. That didn't really make sense. Although she was oriented to the day and to myself, remembering me from a year and a half ago and to the situation, she clearly did not recognize the level of her psychotic process. When asked if she was hallucinating or having psychotic thinking, she would grimace and smile and laugh and say no, and then she would say that everything is fine and she wants to go home. She just kept repeating, I just feel fine and I want to go home, and saying things like, I'm on a mission. The patient basically was very confused last night after admission, where she was wandering around the room, standing in the corner, staring at the wall and laughing and grimacing. She probably got 2 hours of sleep early in the morning. That was common for me when I was psychotic, which was a lot of the time. All the 3 years that I was, a lot of the time I was off medication. I would stay up most of the night because the voices and hallucinations would keep me up. But has been refusing medications and has not been eating, and she clearly is rather cathectic. My mom looked up what that means for me, cathectic, and apparently it means wasting away from your illness, so I'm not sure if that's what they meant. The patient's past psychiatric history shows that she presented very similarly in November 2010, and at that time still had better orientation and better thought process. The patient at that point also was very resistant to the idea of any medication management, but reluctantly was started on Abilify, where she got akathisia. That's like when you get all fidgety in your body or on the outside. And this was switched to Seroquel, which is over-sedating, and then finally put on Invega. She is also tried as an outpatient on some Zyprexa, which she refused taking because that made me gain weight. Not one of the reasons I didn't want to take that, and just because I didn't think I needed medication. The patient has had problems of eating disorders since she was 12 years old. It was around 10. It kind of started when I was 10, but maybe more prominently when I was 12. But both restricting and purging, and has been eating disorder facilities in the past. And as soon as she was discharged from one facility, she'd go back to original behavior. That's true. The patient has been exhibiting binging and purging and restricting her food over the past 2 months. Although she is doing less in terms of binging and purging and mostly has just been anorexia. When I was in Davis, they kept thinking, because they knew my history, and I would have to like sit by their station every time after I ate because they thought I was going to purge. I think I only purged there once, but I think they assumed that I was binging and purging, but I was restricting and calling it fasts. But I don't recall purging there this time of my illness. Later on, I started my third hospital stay. Around that time, I was participating in binging and purging, but I don't think I was this time. Maybe I purged like once that I remember. The patient also has been prescribed Prozac in the past as well, and has had some therapy-related eating disorder, but otherwise had no previous psychiatric history prior to her hospitalization in 2010. And it says under substance abuse history, it says completely unremarkable for any current or past use of illicit substances, alcohol, smoking, or cigarettes. So I assume that they meant that was pretty remarkable, that I've never done any of that when I haven't. Let's see. The patient's mental status examination shows that she's alert, but her sensorium seems rather bizarre, as is her effect, with a lot of grimacing, smiling, laughing, and intermittently with her eyes bugging out and looking kind of sad. She looks very distracted and looks like she's responding to internal stimuli. She is oriented in terms of time and day and to person and to situation, but I do not believe she has any judgment or insight in terms of the severity of her psychotic condition. I thought all the voices and everything I was going through was real, so I didn't think I had a psychotic condition, even though I was going through those things. The patient's thought flow is random and repetitive, mostly talking about "I'm ready to be discharged, I'm ready to be discharged, I am fine" over and over again. The patient did state that she is blessed in terms of how she feels. I'm not sure if that was a typo. Doesn't make sense to me. And does not feel that she has any problems. The patient did not give me answers in terms of why she's not eating and why she's refusing her medications. The patient does not have any pressured speech or flight of ideas or looseness of association, and does not look hypomanic or manic, but rather just bizarre and psychotic. The patient denies suicidal or homicidal ideation, intent, or plan, and she does not answer when asked about hallucinations, either auditory, visual, or tactile, but does apparently appear to be psychotic. She is very delusional in terms of religious preoccupation, at one point saying she was married to Jesus, and other points saying she's on a mission from Jesus. When asked who is the president in terms of her orientation question, she gave the president of the LDS Church. The patient's remainder of her cognitive test was very difficult to discern because she was not very cooperative, and abstractions, calculations, and task performances were not obtained. The patient was oriented and did have some general fund of knowledge, however, and her memory does appear to be intact, although she was rather confused about how long ago it was that she was at Davis Hospital, thinking it was several weeks ago when it was only a couple of days ago. The patient's judgment appears to be significantly impaired, and her insight also appears to be poor. A risk assessment was done on the patient, and based on the past psychiatric history and recent history, collateral information, her mental status exam inpatient, but not necessarily patient's report, which is unreliable. It is my professional medical opinion with reasonable medical certainty that she is at high risk and danger to herself and possibly to others due to her disorganized, confused, psychotic state and delusional state. And then it says about my diagnosis here. It says the patient was originally diagnosed with schizophreniform disorder, but clearly has been ongoing for a year and a half. She meets either criteria for disorganized schizophrenia or schizoaffective disorder. And this is the first time I read about this schizoaffective in the diagnosis. My psychiatrist told me about it, but I never saw it before. Schizoaffective is a combination between schizophrenia and bipolar, or schizophrenia and depression. I'm not exactly sure which one they were referring to. I did stay up all night, and I think that's a symptom of maybe being manic and bipolar. The patient is malnourished and slightly dehydrated. And yes. Based on the patient's current condition and ability to take care of herself, her severity and the worsening of her psychosis and refusal to eat, it is my professional medical recommendation that the least restrictive environment would be a mandatory hospitalization. Currently, the patient is on the ward due to bed space, but ideally may be suited for the PICU. Since patient has been met for a white sheet and for forced medication hearing and has been approved for medication commitment, I recommend a trial of Risperdal Consta. Because of her diminished weight, I would like to reduce the dose that she gets 25 milligrams for 2 weeks. In the meantime, I'm going to also have her take Risperdal 2 milligrams at bedtime in the single dose, and look at possibly another milligram QAM on a PRN basis. Not sure what that means. Until Risperdal Consta has effect to work. I do not want to overdose the patient because of her diminished weight and muscle mass. The patient will also need IV fluids as well as nutritional supplement given her malnourished state. I'm going to repeat BNP in the morning. The patient's strengths are that she has been successful in terms of running her own business, has been rather self-relied for a while, and has not used any substances or drugs, and has a strong family support. Her weaknesses are the severity of her psychotic condition and her lack of insight and understanding about a psychotic condition and refusal of medications that may be necessary to help her. I definitely think they're necessary. Prognosis is guarded. Let's see. At the present time, would recommend treatment at the least restrictive alternative as an inpatient treatment on suicide watch and elopement precautions treatment by a board-certified psychiatrist with the treatment goals of stabilizing her mood, decreasing her psychotic symptoms and delusions and hallucinations to where the patient can have active reality testing and be able to take care of herself, to decrease her anorexia to where she has adequate nutritional status and fluid status, and she has that she is not at immediate medical risks, and to be doing so in such a way that she's able to take these medications or has enough clear stability to be managed as an outpatient through Uber Human Services. Okay. And then they took down like my stats. Her height is 5 feet 3.5 inches. I'm 5'4" last time I checked. I think I've grown a little, or just a little. Her weight is 99 pounds. BMI is 17. And then this is the discharge. I think a lot of that was when they checked me in. And the discharge, they gave me a diagnosis of schizoaffective disorder, anorexia nervosa, malnourishment, psychosocial stressors severe in terms of social support, and her psychotic condition. So that was the psychiatric reports from my second hospitalization, and I hope you guys enjoyed listening. And if you liked my video, then you can give it a like, and you can subscribe to my channel. And I hope I brought you some entertainment and you liked the video. And love you all, and God bless.